Hello and welcome to my YouTube channel. Really glad to have you back here. I'll be speaking to you very briefly on a topic called giant cell arteritis. I've done a previous video on causes of headaches, and one of the causes of headaches is giant cell arteritis. Now, another name for giant cell arteritis is temporal arteritis. I'll just define these terms very quickly. Now, temporal, because this part of the head is referred to as the temple, okay? And so if you have a blood vessel there that is inflamed, this area is called temporal, and then if a blood vessel is inflamed, it's called arthritis. Now, arteritis simply means inflammation of an artery, a blood vessel. Now, this condition comes under an umbrella term called vasculitis, which is inflammation of the vascular of blood vessel. So, giant cell arteritis, temporal arteritis, same thing. Now, how do you recognize this condition? Number one, prominent symptoms will be headache. Usually, this patient will tell you that they have unilateral or one-sided headache. Number two, they will tell you that they have scalp tenderness. In other words, when they brush their hair, they feel this pain or discomfort on that side of the head. Number three, they could have jaw pain. Tell you when they're chewing, they're having pains in the jaw. And number four, there could also be eye involvement. Now, this is why this condition becomes very important. The eye involvement can be prevented if action is taken before that. Unfortunately, giant cell arteritis or temporal arteritis is one of the causes of blindness. Unfortunately, the blindness that can occur sometimes from giant cell arteritis may be irreversible. And so this is a condition that requires a lot of care and caution. If you're having headaches, unilateral as one-sided usually could also affect the other side anyway. Number two, jaw tenderness or pain in your jaw, scalp tenderness, and then problem with vision, double vision. Please, very importantly, the two specialists that you need to see very urgently will be the rheumatologist and the ophthalmologist, and the medications that can be used to address this condition. When, in terms of examination, the doctor will ask you these questions information I've raised, and then they will do certain tests which include the inflammatory markers. Now, usually because there's an inflammation of the blood vessel, the inflammatory markers such as the ESR, that's erythrocyte sedimentation rate, or the CR reactive protein, these are just markers of inflammation, will tend to be raised. In addition to that, they could also ask for a temporal artery ultrasound scan, which is a scan of the blood vessel to see whether there is indeed inflammation, and sometimes may go further to take a small portion of the blood vessel to see whether it shows features of giant cell arteritis under the microscope. Importantly, medications will need to be started as urgently as possible to prevent side effects, to prevent complications. And so hopefully you've picked up one or two things about giant cell arteritis, and if you haven't subscribed, please do. There are a number of videos already in this channel that you can watch and learn more. Thank you, and see you next time.